Did you ever feel that you're having trouble getting hard in bed? Or you do get hard in the beginning, but it's difficult to sustain that erection? And this leads to sexual performance anxiety and you start taking pills. Well, pills are not a permanent fix, but rather a temporary solution. What if this can be fixed permanently? But first, we have to understand what erectile dysfunction is. Erectile dysfunction ED, which is also known as impotence, is the inability to achieve or maintain an erection sufficient for sexual intercourse. And it's a very common condition that affects an estimated 30 million men in the United States and around 332 million men worldwide. Erectile dysfunction can be caused by a variety of factors, both physical and psychological. Some of the most common causes of ED include cardiovascular disease. This can include conditions such as atherosclerosis, which is narrowing of the arteries, high blood pressure, and high cholesterol. Common causes are smoking, lack of physical activity, and eating saturated fats. Diabetes. Men with diabetes are at a high risk of erectile dysfunction due to the damage to blood vessels and nerves that control erection. Neurological disorders. Certain neurological conditions such as Parkinson's disease, multiple sclerosis, and spinal cord injuries can contribute to erectile dysfunction as well. Hormonal imbalances. Low levels of testosterone and libido and high levels of cortisol and other hormonal imbalances can cause erectile dysfunction. Medication. Certain medications, including antidepressants, blood pressure medication, and certain opioids can lead to erectile dysfunction as a side effect. Psychological causes. Psychological causes such as stress, anxiety, and depression can contribute to erectile dysfunction as well. Lifestyle factors. Obesity, poor diet, smoking, and excessive alcohol consumption can also increase the risk of erectile dysfunction. It's important to note that erectile dysfunction may be a symptom of an underlying medical condition and that it's important to consult a medical healthcare professional to identify and treat any underlying healthcare issues that may be contributing to your erectile dysfunction. Symptoms. Well, one of the primary symptoms of erectile dysfunction is the inability to achieve or maintain an erection sufficient for sexual intercourse. However, there are other symptoms that can be associated with ED as well. These include difficulty getting an erection. Sometimes individuals find it difficult to get hard. Difficulty maintaining an erection during sexual activity. Once hard, it is difficult to sustain. Reduced sexual desire. Not having the urge to have sex. Anxiety about sexual performance. The fear of not being able to perform in the bed. Frustration or embarrassment about the inability to achieve an erection, or mental pressure. It's worth noting that experiencing difficulty getting or maintaining an erection from time to time is normal and does not necessarily indicate erectile dysfunction. Erectile dysfunction is typically diagnosed when difficulty achieving or maintaining an erection occurs regularly and causes significant distress or difficulty in your relationship or daily life. It is important to see a healthcare professional if you're experiencing symptoms of erectile dysfunction, because erectile dysfunction may be a symptom of an underlying medical condition such as diabetes or heart disease. There are several natural remedies that may help you improve erectile dysfunction. However, it is important to keep in mind that the effectiveness of these remedies may vary from person to person, and the more research is needed to confirm the safety and effectiveness of these remedies. Some natural remedies that may be used to help improve erectile dysfunction include exercise. Regular physical activity can improve blood circulation, which can help to improve erectile dysfunction. Losing weight, particularly losing weight in men who are overweight and obese, can also help to improve erectile dysfunction. Diet. Eating a healthy diet that is high in fruits, vegetables, and whole grains, and low in saturated fats and sugar can help to improve overall health and may help to improve erectile dysfunction as well. Quit smoking. Smoking is a major factor for erectile dysfunction, and quitting smoking can help to improve erectile dysfunction. Relaxation techniques. Stress and anxiety release cortisol and can contribute to erectile dysfunction, so relaxation techniques such as yoga, meditation, and deep breathing may be helpful. Acupuncture. Some studies indicate that acupuncture may be able to improve erectile dysfunction by promoting blood flow and reducing stress. Supplements. Supplements like ginseng, horny goatweed, and ginkgo biloba are used to help improve erectile dysfunction, although more research is needed to confirm their effectiveness. It is important to note that these remedies should not be used as a substitute for medical treatment. If you're experiencing symptoms of erectile dysfunction, you should see a healthcare professional to identify and treat any underlying health condition that may be contributing to the problem. If you'd like to see more videos like this, please hit the subscribe button.